Hello students, how are you all? Today I am going to start a new topic, that is empyema. First of all, we will see about the definition of empyema. What do you mean by empyema? It is a medical condition that refers to the accumulation of pus in the pleural cavity. First of all, do you know about the pleural cavity? Pleural cavity means it is a space between the lungs and the chest wall. Here what happens? There will be the accumulation of pus. It is the normal lung where in this space the normal pleural fluid will be seen. Whereas in the empyema condition, in this pleural space, we can find the pus. This yellowish coloration will be shown as a pus. It is mostly commonly caused by the bacterial infections such as pneumonia and the tuberculosis. The pus that accumulates in the pleural cavity, what happens if the pus accumulates in the pleural cavity? It keeps the pressure on the lungs, so we can't able to breathe. If the pressure is happened to the lungs, we can't able to breathe, take the breath normally. In this condition, due to the accumulation of the pus, it will create the more pressure on the lungs. Etiology of empyema. What are the causes of empyema? We will see. Mainly in case of lung diseases such as pneumonia and the lung abscess. Here what happens? The pneumonia is the most common cause in case of empyema. In case of pneumonia, due to the infections such as tuberculosis or the lung abscess or any further infections, it leads to empyema. Second one, subphrenic abscess. Subphrenic abscess in the sense it is meant by accumulation of the infected in the diaphragm, liver. If the infected fluid was accumulated in between these three organs, like in between the diaphragm and the liver, or in between the liver and the spleen, in between these organs, if the accumulation of the infected fluid takes place, it leads to the subphrenic abscess. Third one, post-traumatic cause. Post-traumatic cause in the sense, if the client is having any injury to the lungs, like during the any accidents and all, if the injury takes place to the lung area, like ribs area and mediastinal spaces, in any lung area, it leads to the empyema. During the post-operative complications also, mostly pus will be formed in the pleural cavity. Then blood spread and iatrogenic. In some of the conditions, the etiology is unknown. We can't identify what was the exact cause that leads to empyema. What happens if the empyema takes place? It causes the inflammatory response that leads to the accumulation of fluid and pus in the pleural space. Thus, it ultimately leads to the compression of the lung. So, it further leads to decrease in the oxygenation. It causes the distress. Ultimately, the patient will have the difficulty in breathing. The most four common factors we can observe in this empyema condition are during the immunosuppression, alcoholism, diabetic mellitus, and chronic obstructive pulmonary disease. In case of all these conditions, what happens in case of any immunosuppression or anything, there will be the further infections, further risk of infections. During the intake of alcohol and all, we will have the complications like this empyema. The main etiology is classified into traumatic and non-traumatic. In case of non-traumatic, what happens? The thoracic sepsis or extrathoracic sepsis. In case of extrathoracic sepsis like subphrenic abscess, hepatic abscess, if the pus collected in between the any of these organs. And in case of thoracic sepsis like pulmonary diseases, mediastinitis and osteomyelitis. In case of pulmonary disease, it happens in pneumonia, TB, bronchiectasis and lung abscess. Whereas in case of osteomyelitis, we can observe in sternum vertebra and ribs. Then in case of traumatic like iatrogenic and non-iatrogenic. In case of iatrogenic, it is again lung resection, esophagitis, paracentesis, thoracis and the liver biopsy. Whereas in the non-iatrogenic, it is stabbing gunshot wounds like that. In case of these conditions, what happens? The further risk will be increased and more pus will be accumulated in the pleural space. Next, pathophysiology of empyema. If the area is affected with the any infected with any bacteria, it ultimately results in the formation of the pus. First phase involves the accumulation of exudative fluid in the pleural space. First of all, what happens? The exudative fluid in the pleural space will be formed. Here in this exudative fluid, what all it contains? The proteins, inflammatory cells, fibrinogens. What it causes? It causes the pleural membranes to become inflamed and thickened. Further, if the infection progresses, like inflammation progresses, what happens in that pus? Fibrin and other proteins also begin to form. So that ultimately it leads to organization and the calcification. And further, the accumulation of the pus in the pleural space, what happens? It further leads to some of the complications like, sorry, including lung collapse, sepsis, and the respiratory failure. Sometimes what happens, in order to drain the pus, surgery is also required. Clinical manifestations of emphysema. What are the main signs and symptoms we can observe in this condition? Mainly respiratory symptoms and the systemic symptoms we can see. In case of respiratory symptoms, we can observe cough with the purulent. If the client is taking the breath, the pain will be observed. Whereas comes to the systematic symptoms, fever, night sweats like diaphoresis, fatigue and weight loss. Due to this increased pus accumulation and all, the person may infected with further infections. So ultimately leads to the fever and further infections, and the patient will have the loss of appetite. So the client may undergo into the weight loss. Next, diagnostic findings. How we can identify the person will be affected with this emphysema. Imaging studies like chest x-ray and CT scan, we can easily identify this empyema. In case of chest x-ray, what happens? Here we can't be able to detect the small amount of fluid in the pleural cavity. Whereas in the CT scan, it determines the extent of the disease. In what is the amount that is extended in the pleural cavity, we can easily observe in the CT scan. These studies will clearly show the how the extent, what is the extent of the fluid in the lungs. Whereas in the laboratory test, we will identify the complete blood count, blood cultures, pleural fluid analysis. In case of blood CBC, we will identify the leukocytosis and anemia. What is the causative organism like any TB or pneumonia and all, we can identify with the blood cultures. And in case of pleural fluid analysis, we will identify the presence of pus, glucose, protein and the LDH levels. These are all the tests we can easily identify the empyema. Next, management of empyema. Mainly, what is the main goal of this medical management? We need to prevent the infection or control the infection. Then symptoms must be relieved, because if the symptoms are aggravated, the patient may further feel discomfort. So we need to focus on relieving the symptoms and prevent the further complications. Mainly, it involves giving the antibiotics, analgesics and the supportive care. Broad spectrum antibiotics will be used based on the culture and the sensitivity results. Based on the patient's condition, the antibiotics may be given intravenously, and we need to observe for the patient response whether the patient is recovering or not. We need to observe for the response to the treatment. Next, as the patient is having pain, we need to concentrate on the pain management. Pain management involves the giving the analgesics such as acetaminophen and non-steroidal anti-inflammatory drugs. It helps us to relieve the pain and reduce the fever. In case of severe pain and all, opioids also used. But in most of the cases, we need to avoid using these opioids because it may further leads to respiratory depression and other side effects. Next, supportive care. Supportive care involves oxygen therapy, chest physiotherapy, and nutritional support. In severe cases, like if the pleural fluid is accumulated with more pus, and if the patient is had gone to further distress, mechanical ventilation also used. Here we need to identify the patient's vital signs, fluid and electrolyte balance, and other parameters such as lab investigations, and we need to take the appropriate interventions. We need to take the appropriate measures where and when needed. Nursing management of empyema. Nurses plays a crucial role in case of the patient is affected with empyema. If the patient is having the medical management, the nurses should assist with the medical team. Will need to cooperate with the medical team to ensure that patient receives the appropriate medical management or not. Whether they are taking the antibiotics in proper time and correctly or not, we need to monitor everything. And chest tube drainage for any blockage or it's flowing or not correctly, like that we need to observe for that. Any further infection or oozing, any bleeding and all, we need to observe. And surgical interventions also, if the patient had underwent any surgical interventions, we need to monitor for any post-op complications or post-op. Nursing management. Nursing management involves to monitor the vital signs, assessing the respiratory status continuously in case of critical conditions, administering like medications. Like if the doctors are prescribing any pain medications and all or antibiotics, we need to observe whether the patient is taking continuously and in a proper way he is receiving the medications or not. We need to identify and provide the patient education. In critical cases and all, the patient may undergo surgery. So, nurses should cooperate with the surgical team and need to observe for any pre-op and post-operative care, and it includes the post-op complications. If the wound care was properly done, so further complications will be prevented. Patient education. We need to identify the client who's the person is affected with empyema, and we need to identify their signs and symptoms and what is the importance of medical and nursing interventions and what is the care to be taken after the discharge to prevent the further complications like this. We need to explain the complete recovery and complete wellness. We need to identify the complications and we need to educate them completely. So, in order to prevent the further complications, the patient should be encouraged to take the proper care. So, in this today's topic, we had covered the definition of empyema, etiology, risk factors, pathophysiology, clinical manifestations, what are the diagnostic findings to be performed in order to identify the empyema, and what is the medical and the nursing management. Thank you.